So I have that it's just the top of the hour. There are still a couple of more people in the waiting room. Of course, we're waiting for a couple of other people. So again, thank you all so much for being here early. I'll just remind you that the first thing that we're going to take a little bit of time to focus on is, as you may recall, you identified a particular growth opportunity for you. And I asked you to look into TAP 21A and see if you found a capacity that was related to that particular growth opportunity. So will be kind of our starting place after we take care of some of our logistics. Again, I want to thank you all for being early and for being on time for part 3 of our learning community conversation about Clinical Supervision Foundations II. After we take care of the brief logistics, we will start with the area, the supervisory sort of role area that you identified as a growth opportunity, and what you may or may not have found in TAP 21A as a capacity that you would focus on. All right. So folks, I would like to go ahead and get started. We have a particularly robust agenda today. I have 2 additional resources that we're going to touch on. One we've kind of referred to already. In fact, Charles mentioned it yesterday, which is TAP 52. We're going to talk a little bit about that today. And I'm going to share my screen. So folks, again, we're at part 3 of our learning community conversation. And please follow Dr. Holly's lead. Anytime you have questions or concerns, just unmute and share them. We're fortunate that we're a small enough group that we're able to do that. We are in our learning community conversation. Thank you, funder, for making this possible. And what we talk about may not necessarily represent the funder's official views. We, again, want to remain being intentional about language. Please continue to follow these guidelines of being on camera, remaining muted. But again, please follow Dr. Holly's excellent lead. Unmute whenever you like. You can interrupt me at any time. And if you do need to step away or turn your camera off, just let me know that. And when you come back, just turn your camera back on. And these guidelines will prevail hopefully today and in our fourth learning community conversation about this as well. And for extra credit, and I know some of you like that, type the date of our 4th conversation into the chat at this particular point. If you know the date of the 4th. All right, folks. So again, I just want to confirm, can everybody agree to those guidelines as stated? Yes? Thank you. Thank you so much. Perfect. All right. And thank you for typing the date and the time in the chat. And again, I'll remind you, I know you know this, because some of our colleagues have been talking about it during our time together, but you will have to complete the course, you will have to complete and submit the professional development plan, and we will spend more time talking about that in greater detail in part 4. We will touch on it again today as it's relevant to the content that we're covering today. So I'm going to go back to sharing my screen for just one moment. Thank you for agreeing to those guidelines. Now, you may remember when we met yesterday that I invited you to identify one of these roles that you identified as a personal growth opportunity. And I know that part of this learning community conversation about clinical supervision, hopefully, is turning into an opportunity for you to come to know yourself better and to consider yourself in this role if you're already in it, and to anticipate yourself in this role. And hopefully it's an opportunity for you to dig deeper into the various aspects of clinical supervision that we're going to be covering during our time together, which, if you really think about it, 12 hours in 4 3-hour sections is not really a whole lot of time to focus on. And I know you had the 14 hours before, but it's not actually a whole lot of time for a process that you may engage in for a significant number of years in your career, and may have done so already, actually. So when we talked yesterday, I did ask you to identify a particular area you thought was a growth opportunity. And then I asked you to consult TAP 21A, which is for the clinical supervisor, and to see if you could find a competency that supported or touched on the particular growth opportunity. So I'm going to stop sharing my screen at this particular point, and I'm just going to ask, what was that like for people? What did you come up with? What was your experience of thinking about that growth opportunity and then consulting that particular resource as a way to dig deeper or look more into that particular competency in regard to yourself? So thoughts, reactions to that. So the floor is open. You can unmute and share your experience about that.
As for me, I did not find nothing much in that in top 21A, but I look into top 52 and I found tons of resources in that for supervisors. So I just look into top 52. That was where I got my information from.
Fantastic. So Beretta, can I ask you a quick follow-up question?
Mm-hmm.
So what was the role that you identified as a growth opportunity?
Mentoring.
Excellent. So what I want to acknowledge, and thank you for kind of starting us off in this conversation, what I want to acknowledge is that you consulted the particular resource and it didn't really speak to you.
No.
So you went to another resource,
yeah,
TAP 52.
That's it.
And that one you found very
friendly. It was friendly for me.
And very interesting.
Very, as much.
Fantastic. Fantastic. Beretta, thank you so much for starting us off.
Okay.
Now, I see that Ruby put in the chat, mentoring/leadership speaks about mentoring, coaching, and teaching. And Ruby, do you remember what capacity that was? Did you note which competency actually that was?
It spoke about leadership. It spoke about leadership
Okay.
being defined as social influence process in which supervisors voluntarily participate with supervisees. And teaching them organization skill, different roles, as being a counselor, working cohesiveness, team building, organizational skills. So I found that in TAP 21A.
Fantastic. And did you notice what number competency it was?
I think it's FA2.
Okay.
FA2. It was the first one, and then the second one from the bottom that it talked about mentoring.
Do you mind sharing your page? What page number you referring to?
I was on 16.
You was on 16. Okay.
Okay. Page 16. Fantastic. Thanks so much, Ruby.
Thank you.
Anyone else? And you can start us off by letting us know what was the role. Yeah, Dr. Holly, did you want to comment?
Yeah. So for me, I identified evaluator. So for me, that's on page 33.
And folks, if you want to,
TAP,
while Dr. Holly's talking, you can turn to page 33 in TAP 21A. But go ahead, Dr. Holly. Yeah.
So I think my major issue here is this. I have based on, this is probably my third supervisory training, right, across the country. However, when I go into an agency, they usually have one or two things going on. They don't have a template at all when it comes to evaluation. You
Yep.
have to come up with one. And then when you're audited by different accreditation bodies, it's either not good enough or it's missing stuff. So, of course, it falls back on the supervisor because your tool may not be used well enough for you to properly evaluate. So I struggle with that. I can definitely communicate agencies' expectations, the policies that are in place according to
Right.
the type of level of care that's for the agency dealing with, again, the type of clinic, right? But it's just, I guess, I don't even know if this is a real thing, but just the bureaucracy around like what evaluation tools are being used so that it makes sense. I don't know if that's like a real thing, but that's my issue.
Right. And Dr. Holly, just so I'm clear, when you say evaluation of the counselor's performance?
Yes. So their performance. Okay. So breaking it down from a supervision lens is administrative and clinical, and
Yep.
there should be some type of a evaluating tool that you can
Yes.
kind of check boxes, or kind of like what you showed us before with the developmental plan, but
Yes.
think of it as an evaluator, right?
Understood.
Right. And
So,
it'll vary. Either the agency don't have one, you have to create one, and then you're looking at the accreditators who come in to audit you, and it's like,
right. Not good enough, or there's something missing.
yeah. So
Right.
I don't know
Right.
if that ties into this, but that's why I struggle, because it's like, how do you know what you should be evaluating, but how do you translate that, I guess, so that it works within an agency who probably don't have all their T's crossed and I's audit, and then your accrediting bodies who come in for audits. Hopefully that makes
Absolutely.
sense.
It makes complete sense. So, Dr. Holly, just so I'm clear, and Julia is very strongly agreeing with you on this. What it sounds like you're saying, and Julia's agreeing with you on, is that there needs to be some sort of ruler to be able to evaluate particular competencies for the counselor, so that it's
Yes.
got it.
Yes.
Some sort of rubric.
Yes, exactly. Because I can do all these things here on page 33, but if I don't have a rubric to give me that, I'm going to create my own based off all the trainings and background that I have. But then
Understood.
but then you just run
Understood.
some other issue. Yeah, some type of
Understood.
instrument, somebody said.
And Dr. Holly and everyone else, I want to assure you, stay tuned, because before the end of today, you were going to be introduced to a rubric that works with TAP 21, the provider competencies, a rubric that correlates directly to each competency so that you can actually evaluate. So thank you for being here.
Oh my gosh.
And Dr. Holly, I don't know if you're familiar with the definition of the word plant, but somebody who's in the training who raises the topic that you actually want to get to. So everybody will leave today with that information as well. Okay. And if we can, let's hear from one other person who identified in TAP 21A, which again is for supervisors, one other person who identified a particular resource in TAP 21A that spoke to their opportunity for growth in terms of the roles. Did anybody else identify something in TAP 21A that was helpful?
I can go.
Oh, okay. And then go ahead, Heather, and then we'll go to Zachary. Go ahead, Heather, please.
Okay. I was just going to say, I picked the mentor role, and particularly the area of a challenge with acceptance. And then the competency would be to help supervisors develop skills of empathy and acceptance specific to working with culturally diverse clients.
And which page is that on?
Let's see. In TAP 21, that would be in
TAP 21A.
Yeah, page 26.
Fantastic. Thank you.
I mean, it might be page 34, but it's labeled 26.
Understood. Thank you so much, Heather. And Zachary, go ahead. What did you What was the area, the role growth area, and what did you find in TAP 21A as one of a number of resources that we have available to us? And remember, folks, and I know I'm repeating what you know already, but I just want to underline it. TAP 21A is for the supervisor. It's the competencies of the supervisor. 21 is the competencies for the supervisee. Go ahead, Zachary. Zachary's in mid-chew. Sorry.
I had the coach role, and so I, identified. I think several people have said it's the FA2, the leadership competency.
Yes.
17 and 18, and I identified it was the guide through motivational empowerment rather than control, facilitate work through team building, training, coaching, and support. Was the competency that I identified. I thought it was interesting though. It seemed like they had some suggestions, but there was not necessarily any way to like get there. There wasn't any like tool for read this, do that. It was just sort of like, you should do this, and and it's sort of up to the supervisor to figure out
the
how
road
to gain those skills.
Thank you. And Zachary's making a really interesting point, because you will also experience similarly when you work on your professional development plan for the supervisee, where you can evaluate the competency, but they may not tell you, it won't list like, well, you should have them look at this resource, or you should have them do this. As the supervisor, you'll have to put the flesh on that in order to determine what is the resource that's going to be best for this particular supervisee. And that resource might be attending a particular training on cultural humility, or attending an extra supervision meeting a week. So it will be to your sort of best thinking and your casting about for resources to figure out how to support. And you can also engage the supervisee and ask them what might help them achieve the goal as well. But you build that into the professional development plan. Okay? So let me say this, folks, as we make a transition into what I'm going to ask us to focus on next. We're in this learning community conversation. This is one particular point in your journey as a clinical supervisor, where you have the opportunity to be in a learning community with other people focusing on clinical supervision, the practice of clinical supervision. And this is one of hopefully many opportunities that you will have in learning communities to continue to grow your capacities as clinical supervisors. So this is one part of hopefully a lifelong journey in your career as you continue to develop your own model of clinical supervision. Okay? So TAP 21A is a resource. TIP 52 is also a resource. TAP 21 is a resource. So these are all resources that you have available. And I want to go back to something that Beretta sort of demonstrated. When a resource doesn't have what you need or speak to what it is that you may be focusing on, feel free to go to other resources. I know that's a very obvious and basic thing to say, but I just wanted to underline it because I love the fact that Beretta said, yeah, I looked at TAP 21A. It didn't really do anything for me. So I went to TIP 52, and that did help me. So I want to underline that. I'm going to share my screen again, and I'm going to remind you of this particular scenario that we focused on last time. And you may remember this, and hopefully, and if you did, please put it in the chat, but if you did get the slide deck that I sent you that put all the tips, the practice tips, if you got a chance to get that slide deck, just type a Y in the chat. Tree, I believe, sent it out yesterday. I just want to make sure that everybody got a chance to get that. And those were tips that were related to this and other scenarios that are in our participant workbooks. But you may remember this particular situation, and I'm going to read this out loud. And what I'm going to ask you to do is I'm going to ask you to try and put yourself in the mindset, at least in this instance, of the supervisee. So the scenario is, a supervisee's former supervisor was highly critical, directive, and constantly disappointed in the supervisee's performance. Now, in a new supervisory relationship, the supervisee is hesitant, afraid of criticism, of taking risks, and of being observed. Even though the supervisee is achievement-oriented, there seems to be a strong fear of failure. Supervisor notices the resistance to supervision and is trying to communicate that making mistakes and taking risks are a natural part of the learning process. Now, we discussed that particular scenario yesterday. A number of you made excellent suggestions about how we might proceed with this. One being, and please tell me if I'm remembering this correctly, one being that we would want to explore with this supervisee, invite them to tell us about what their prior supervision was like, and what works for them in terms of supervision and what doesn't work for them in terms of supervision. So that was one of the strategies in using open-ended questions. Now, I asked you to kind of put your mindset into the position of the supervisee. So given this particular scenario, what do you think might be most important to the supervisee? What do you think the supervisee might need most or be most important to them? And feel free to unmute. And go ahead, Dr. Holly. Yeah.
I want to say this, but I don't want to sound like it's therapy, but I would come from a place of emotional regulation, meaning that I would try my best to calm their fears or their anxieties around me giving them the same experience that they have previously had with another person. They can be coming in very nervous, on edge. So I would try to, like, get them to like an even baseline so that they can hear me, that I'm not going to give them that same experience and this is how I'm different. But if someone is kind of like very anxious, frustrated, or again, they're emotionally high,
Yeah.
I don't know if I'm going to be able to penetrate for them to even hear me or receive that I would be different.
Understood. And Dr. Holly, what you're communicating, just so I'm very clear, is you're communicating how, as the supervisor, what you would try and create for them and how you would try and help them to kind of regulate and feel safer in the conversation with you. And the primary message you'd be communicating is, I'm not like them.
Right. So that's what I think the supervisee needs. So that's what I would try to provide.
Got it. So the supervisee needs to know you're not going to be like their prior supervisor.
Exactly.
Got it. Any people are putting things in the chat. Does anybody else want to unmute and share? Give them some time to develop the relationship. Yes, Eunice, I couldn't agree with you more.
I was just going to share that. I mean, everything stated, but we have to give it the time frame that's needed to develop the rapport, to develop the relationship, because it's like, I don't want to use, it's like testing time, is being able to see that, you are who you say you are. and giving the comfortability, sticking with the time frames and just keeping the door open so that they can ask questions and feel comfortable.
Got it. Lourdes, and then we'll go to Brittany Davis. Go ahead, Lourdes.
Yeah, I'm sorry, excuse me. Yes, being a supervisee, I experienced that, as I said, past 2 years of my life with 4 supervisors, because it keeps on changing the structure. So, but then I realized that my present supervisor is very good. I mean, I thank God for him. That's why I know the contrast. So I'm saying is, I feel that as a supervisee, what I'm looking for is that I can talk, that there's an, like that whatever is it, even though I think she already knows, because she's also an experienced person, that what I'm looking for, which I'm already experiencing personally, is that we can talk freely, that whatever I feel, she will understand, though we are not bad mouthing, but we are talking with the same objective, that how can we move on this project, how can we move on this situation. But with me giving a little credit of, I know a little bit, that I know this is what it is, because I was in this position for a while. So
yes.
That, because I think one my supervisor before are so much, what do you call that, power imbalance is so much.
Yes,
They're
yes, yes.
executive, they are LLC and whatnot, and they seeing me like, hey, I don't know what you know. But the problem with this sometimes, because we are in the ground, we are here in the ground, they are there. Although they experience whatever happened, but that could be in the past. What happening now is now. So
Understood.
that probably, I feel, what a supervisee, I want, and it's happening right now. So I'm happy that it's happening with my supervisor, which is very open. We can talk, she can tell me if it's wrong. I can tell him, oh, I'm so sorry. But it's a good idea to have an open conversation, and knowing that you are valued, that your skill is
Understood.
balanced, that you are there because you want the objective to be done, that you want the work to be done, that you want something good for yourself, for the company. So I love that. That's what, as a supervisor, because that's what I am right now.
Understood. And I want to underline 2 things, and then we're going to go to Brittany Davis, and then we'll go to Charles. But I want to underline 2 things you're saying, Lourdes. And one is that this supervisee in this situation may really want a space where they know that they'll be listened to. And they also want to know that when they do take the risk to share, and again, I'm thinking of Eunice as I say this, at time permitting, as the rapport builds, that when they do share, what they share will actually be valued. Understood. Brittany, the floor is yours.
Hi, I was just going to say, and I think somebody said it maybe yesterday, but the way I would approach it is clear expectations, getting a sense of what their expectations are for supervision and what my expectations are. But then also, and somebody had said yesterday too, it takes time. So it's going to take time maybe for them to build trust that those really are my expectations, because sometimes, actions don't really match up with the words. I can say, hey, look, this is my only requirement, but then the responses I'm giving you don't match that. So setting our expectations out on the table, but then also giving the time to prove. I think that I say what I mean, that this is really what I'm holding you to, and I really mean it, that I'm here for you, and trying to be a helper, not from a kind of punishing type of standpoint.
Right. And you're making a really great point, Brittany, which is that integrity takes time to sort of present itself. So through time and through following through and keeping your word and validating, yes, you will build integrity with this person, and they will know, oh, they, like Dr. Holly was saying, they're not like the person that I was being supervised before.
Right. Because you can say, oh, I promise I'm different. It's not like that. But when it's a new person to you, like they're
Right,
like,
right. Yeah, yeah.
it doesn't matter.
Thanks. Yeah, yeah. Thanks for sharing. Right. Like, why should I believe you? Yeah, yeah. And
oh,
no,
sorry.
go ahead. No, jump in.
I also just want to put in perspective that it's hard to say that you're not like that other person. I think like it's so important to have that initial conversation with your supervisee of what was that experience like for you, to kind of, because perception is key. At the end of the day, it could very well be that supervisor was not awful and they were constantly being talked to because they needed to constantly be talked to. So then with me promising that I won't be like that person, and then turns out I kind of have to be, that would be an unfortunate situation for that supervisee to then feel like they're being treated like that again when it might be a them thing. So to really have a understanding in the beginning of what your perception was, and then kind of, this is what I do, this is my expectation, and go over those expectations, I think are really important.
Yep. And I'm gonna jump in here and just say, Charles, I didn't want you to fall off the table. So come back, and then we'll go to Juliana and then to Beretta. But I want to underline that it's really a kind of a powerful message if you communicate to a supervisee. You can have expectations of me as your supervisor. You can have expectations. That's okay. You have expectations and I have expectations. And I love the way Brittany Davis said it. Let's put them all on the table. Yes. So Charles, are you still there? Because Charles had his hand. Yeah, go ahead, Charles. Go ahead.
I'm still here. Can you hear me?
Yeah, we can hear you.
Oh,
it's working.
Works.
Good. Yeah, and then we'll go to Juliana and then to Beretta. Go ahead.
You know, we talk about from the perspective of the supervisee, and I'm thinking of someone who experiences not as a one-time thing, but as over a period of time, who experiences may not have a voice, where someone has been probably, there's a lot of floor-based kind of things. I think what I probably want to hear is, a lot of, validation, affirmations, looking at, a strength-based approach, being able to tap into that. But also I need a partner. I understand there's a power differential. There's a supervisor, there's a power differential. But having that voice so I can collaborate and be heard. And I think that as a supervisor, I think that goes a long way in terms of building trust. So support and encouragement kind of approach. And then, understanding that there's growth opportunities, but being able to be an active participant in my development.
Fantastic. Thank you, Charles. Juliana, the floor is yours.
I just wanted to, I appreciate what Brittany said, because, I've gotten in trouble before when I'm wearing my therapist hat a little bit too tight and let a supervisor know that, oh, I'm not like that. Like, I'm here to really help you and support you. And I'm not, like, I really want to help you be successful and get you your license and all this stuff. And then it turns out that they, were in a position to really start hurting clients because of their lack of competence. And, I ended up having to be the one that fires them, that gatekeeps.
Yep.
And, and then they perceive me as just the same as the last one, where, so critical, and so just to remember that, we can be approachable and person-centered and try to develop that relationship, but we can't have unconditional regard for somebody, that potentially is going to be in a room with someone with a mental illness or substance use disorder. And we are evaluators. And so, like, I learned the hard way that, like, there is a limit to my clients. I don't have to grade them. But my supervisees, I sometimes have to give them really hard information. And I had one that she wouldn't accept any feedback, and I ended up having to end the relationship.
Yeah. And Juliana, you're bringing up again, one of the things we really have to never lose sight of as supervisors, two things really. One, and I love the way you put it, I was wearing my therapist hat a little too tight, because remember, like we talked about, and Trisha, I know you're going to comment in a moment, but remember, Trisha was talking about how like people love to come to her because they like her more than they like their therapist. So we're not the person's therapist, and we, of course, we're supporting their professional development, and we must assure that the work is being done at its highest level. And that is why we're in the role that we're in, because we're balancing those two things simultaneously. And to Juliana's point, and I don't want us to lose the realism associated with all of this talk about clinical supervision. Sometimes being a clinical supervisor is very hard and it's very painful, and we do have to fire people, and hopefully they're going to move on and be in a position where they will be able to continue to grow. But sometimes we are in that role, and it is not an easy thing to do on many levels, and that's like a gross understatement. So thank you for adding that, Juliana. We'll go to Beretta and then to Trisha, and then we're going to make a transition into another focus. Beretta, the floor is yours.
Yes, I was just thinking out, although supervisors are gatekeepers, as to say, but I do believe that to build trust, we have to be more approachable, and also to demonstrate authenticity and to be empathetic and be in a humanity way, because sometimes people, because they're in that position of, so they're championing some things that is not really nice. Sometimes the behaviors can be really frightening. It can be, like critical and judgmental.
Yes.
And having people depending on you to speak into their lives, it can be more damage, more any good. So I think they need to be approachable. They need to, and not say more over friendly, but operate as a human, being in humanity.
Yeah.
And show support and love, and people be balanced, that you can able to invite people to be comfortable to share with you, even if they make mistakes.
Yes.
Because one of the things I've seen in practice is many times, because of fear, when people make mistakes, they will not own up, or they will not share that they can grow from that mistake.
Yes.
They're afraid of being that big stick over them, or, people might judge them. So people tend to shut up, and more damage is done. So I believe that the supervisor need to demonstrate more, kindness and.
Yes, agreed.
In a humanity way.
Absolutely, absolutely.
And I would say that this is where self-disclosure helps.
And it can, yes, Charles. Yeah.
We're human and we make mistakes. I may be a supervisor, but I've made mistakes as well. And this is an opportunity. Absolutely. Right?
Me too, Charles.
Not coming from a point of perfection, but this is, we are human and we can learn from this and we can develop from this. And that's, I think, sometimes self-disclosure helps move that conversation along.
Absolutely. And to link that to what Beretta just said, and Trisha, don't lose your point, but to link that to what Beretta just said, there's a humanity in that. There's an ability to kind of connect around that. So makes perfect sense. Trisha, thank you for your patience. Go ahead.
All right. No, I was going to say what Miss Beretta was saying, that, a lot of times I know with supervisees, the ones that I have, they're very hard. And that's another thing. It's hard for them to be able to communicate. So it's like you're just assuming how they feel without them telling you, or they might be feeling something else.
Yeah.
So, and that makes it hard. So then it just becomes like this back and forth, and they're not telling you how it feels versus how their actions are,
right,
how the work is.
Right. Right.
So
right.
if you're a supervisee, and I mean, for most of my work life, I've never really had good supervisors, but
yeah.
If you're unable to communicate how you feel to your supervisor, and that's where being more approachable is important as a supervisor.
Absolutely. And I will just throw out that one thing to consider in regard to this particular scenario as a really powerful outcome is if this supervisee, and Trisha, I'm thinking of you as I say this, if I was the supervisor and this supervisee said to me, well, Paul, I haven't really been very open to supervision because I've had some bad experiences, and I'm just very leery about supervision. If the supervisee disclosed that to me, that would be very powerful.
And I think part of that is just trying to build again that supervisory alliance, with the supervisee.
Right. So we're going to make a transition into the next point. So Lourdes, I'm going to give you the floor. If you can make a brief point, just so we can go forward. Go ahead.
Yes, exactly. Very brief, because I think whatever everybody says, especially Charles and the last one who spoke, is very correct. But what I feel, this is just my feeling, okay?
Please.
Really being a supervisor is a responsibility.
Yes.
Whatever happens, what I feel, the lack of communication may be with a lot of things, but maybe one of them, they don't know too what they're doing. Okay, this that they have maybe probably be developed more, or that's what I feel, or they're lacking the vision of the company. They don't know also the reins around the area. So you yourself doesn't know what it is also. So there's no communication, there's no collaboration, there's lack of transparency maybe. So what happens is that there's a cut of communication, because just don't talk to me, I mean. So okay, there's a lot of things. Now I realize among what everybody says, being a supervisor, I valued it now as a responsibility. It's a big one. It's not just a name or like a salary in case of 10,000 or 15,000. It's really, so thank you.
Yes, absolutely. And I couldn't agree with you more that it's a huge responsibility. And I think of something that Zachary said, maybe even in day one, because Lourdes mentioned that, a lot of supervisors get into their roles because they're sort of battleground promotions where they're like, did you say that, Zachary? Am I remembering that correctly?
You are remembering that correctly.
Okay.
I am currently a clinician, the senior counselor, and the interim program manager.
Yes. There you go. That says it all. And we're really fortunate that Zachary's here in this learning community, because he's bringing a lot of that experience. And to Lourdes' point, there are a lot of supervisors who aren't in our learning community today, and they don't know what they're doing. They haven't been given the opportunity to be in a learning community with other people and to focus on these resources, to incorporate the things that work for them and the things that don't. So what I'm going to ask everybody to do now, just as a way of transitioning, is I'm going to ask everybody to access your participant workbook. And I'm going to ask you to go to page 26. And the first person who goes to page 26 and gets there, unmute and tell us what's at the top of page 26.
Self-inventory.
Module 3, Supervisory Alliance.
All right, hold on just a second. I'm going to go there too. And this is in your participant workbook, yes?
Yes.
And which page are you on?
26.
Excellent. Good. Hold on just a moment. Yes. So it says at the top, Module 3, Supervisory Alliance. Yes, if that is the case, put a Y in the chat. Good. Very good. Now you'll see there that there is what's called a self-inventory. And you'll see that there's a rating scale of 1, strongly agree, 2, agree, 3, undecided, 4, disagree, and 5, strongly disagree. Okay? Now, what I'm going to do is I'm going to read out these questions, and I'm going to ask you to determine whether you strongly agree or somewhere along the scale of strongly disagree to the statement that's being read. And I want you to put that on like a separate piece of paper so that you know for question 1, you gave it either a 1, 2, 3, 4, or 5. So that you either strongly agreed, which would be a 1, you were undecided, which would be a 3, or 5, you strongly disagreed, anywhere it fell on that scale. Okay? So I'm going to ask you, just put in the chat right now if you're prepared to jot down your answers to the questions. So just type a Y in the chat if you're prepared to do that. Fantastic. Good, good, good. So I don't want you to think too much about this. Just jot down the answer that seems right for you. Okay. So question 1. On a scale of 1 through 5, either strongly agree or strongly disagree. A positive and productive relationship between the supervisor and supervisee is essential if supervision is to be effective. Question 2. As a supervisor, it is acceptable to me to become socially involved with a supervisee who seems more like a colleague to me. Question 3, or statement 3. I believe that I can be an effective supervisor even though I may not like my supervisee. 4. A supervisor's primary responsibility is to develop an atmosphere conducive to learning. 5. The methods a supervisor uses are more important to the outcomes of supervision than is the quality of the supervisory relationship. I'll read that one more time. The methods a supervisor uses are more important to the outcomes of supervision than is the quality of the supervisory relationship. 6. As a supervisor, I would rarely engage in self-disclosure with my supervisee. 7. Supervision is an appropriate context for supervisees to express and explore their fears, concerns about their performance, and their self-doubts. 8. I believe that many trainees have keen insights, and that really should be, I believe that many supervisees have keen insights, useful reactions, and insightful intuitions that they keep to themselves because they doubt themselves. 9. I think courage is not the absence of any performance anxiety. Rather, courage involves identifying and challenging those fears. 10. To the degree supervisees are unaware of their own needs and personal dynamics, they are likely to use their work mainly to satisfy their unmet needs. 11. As a supervisor, I will strive to develop collegial and collaborative relationships with my supervisees. 12. As a supervisor, I would want to be personal and disclose my professional experiences with my supervisees when appropriate. And the final question, 13. I believe supervisors need to take a personal interest in their supervisees as well as their cases. All right, so those are the questions. You've just all completed a self-assessment. Now, what I'm going to do is I'm going to randomly divide you into 3 groups. And I'm going to assign each group one of those questions so that you can discuss your answers to those questions. You'll see that I just put in the chat that I put in question 2, 5, and 10. There'll be 3 groups. One group is going to look at their answers to question 2. One group is going to look at their questions to answer 5. And one group is going to look at their answers to question 10. And they're in the chat so you can see what those questions are. So I'd like you to share in your group what rating you gave as an answer to that one question. And I'd like you to talk about it in your group. I'm going to give you 15 minutes to do that. And once you've talked about it, I'd like there to be a volunteer reporter. I'm going to emphasize that word again, a volunteer reporter from each group who will say, in our group, our biggest takeaway as we discussed the answer to this question was. Okay, so that's what the reporter is going to report. So everybody goes around, everybody gets to say what their rating was for that question, and then you talk about it, and then as a group, your group reporter, your volunteer group reporter will say, our take on this question was, our takeaway from our discussion on this question was. Okay? Does anybody have any questions about the activity? Fairly clear? If you can see the questions in the chat, type a Y in the chat right now that you can see them. And if you can't see them, type a no. Okay, hold on a second. So everybody's typing no. Hold on. How about now? Excellent. Excellent. And I'm going to put them, after everybody types yes, that they can see them, I'm going to put them in there again, so they're the last thing in the chat. So there they are again. You don't have to answer yes. Okay, they're the last thing in the chat. All right. So remember, you're going to have 15 minutes in your small group. And I'm going to arrange you into those breakout rooms right now. If for some reason you get knocked out, Zoom knocks you out into cyberspace, come back, we'll put you in a room, and you'll just remember which room you were in. And remember, group 1 is looking at question 2. Group 2 is looking at question 5. And group 3 is looking at question 10. Okay? Here we go. Welcome back.
Yes.
So which group number were you?
We were group 1.
Group 1. And some people are saying group 3 also. Okay. So for group 1, who was your volunteer reporter?
Was Miss Smith somebody?
Miss Smith.
Miss Smith. All right. All right. Well, we'll see if Miss Smith comes back from the room so she can give her volunteer report. Here comes everybody. Excellent. I think everybody is back. Fantastic. So thank you for focusing on that. And let me ask, I understand that there is a Miss Alexine Smith is the reporter for Group 1. Is that true?
I'm the mandated.
Now, I thought I gave clear instructions about volunteer reporters. All right, all right.
Miss Smith was voluntold.
She was voluntold. Yes, Charles, thank you for using a technical term there. I love that. She was voluntold. All right. Well, before we give Miss Smith the floor, who is the volunteer or voluntold reporter for Group 2?
Voluntold.
Who was it?
Zach.
For Group 2.
Zachary.
Zachary.
Okay, and Zachary, can you confirm or deny if you're the reporter for Group 2? Zachary looks frozen at the moment. Who knows? He could be having internet difficulties. We'll see. There he is.
Yeah, I'm getting the weird connection here.
All right. So are you the reporter for Group 2, Zachary?
I can confirm.
You can confirm. Now, can I ask you a follow-up question?
Sure.
Were you volunteered or were you voluntold like Ms. Smith?
We did say that it sounded like I was voluntold.
Well, we seem to have a trend running here. Let's identify the reporter for Group 3. Who is that? For Group 3.
I am.
Thank you, Chris. And Chris, can you confirm if you were volunteered or voluntold?
I volunteered.
Yeah, Chris volunteered. All right. So thank you, Chris. So Chris, we're going to start with Miss Smith, then we're going to go to Zachary, and then we will round out the inning with you as our reporter. Okay. So I just want to preface for everybody that Group 1, that Miss Smith is the voluntold reporter, is going to be sharing their outcomes. They had statement number 2, which I will read to you out loud again. As a supervisor, it is acceptable to me to become socially involved with a supervisee who seems more like a colleague to me. Miss Smith, the floor is yours.
I would say that numerically we were at a 4.5 because some people had different opinions. But
I like the scientific bent on this. The numerics, we were at a 4.5. Okay. Which means closer to strongly disagree, right? Okay. So I'm sorry, I interrupted you, Miss Smith.
No, that's fine. And the conclusion that we came to is that boundaries are very important in the work that we do, whether it's at the supervisory level, whether it's at the supervisor level, the client level, even the administration or the organization at large. And so our thinking was that it's better to have a collegial relationship with someone that you're supervising, even if you would want to have a friendship. But there is a power differential that we always have to consider. And when we move those boundaries, regardless to how little or how much we allow the boundary lines to be moved, it could create complications with work assignments, having to maybe have a disciplinary issue that the person is doing something out of line or out of bounds. And it just creates a lot of problems. Now, one thing that came up is sometimes we might think that it's okay to support someone in their endeavors that may be outside of work. And that is one of the group members indicated that they wanted to see a colleague perform because that person was a musician. But they had no drinks afterwards. They went strictly there to hear the performance. and that was it. And so, but I don't think we saw that as much of a problem as hanging out, going to lunch, not the whole group going somewhere together socially, those kinds of things. So it's best to hold tight to the reins of boundaries and work with that person, still building an alliance.
Alexine, thank you so much. So we had just had an excellent report from Group 1, and now we are going to go to a report. I'm withholding my assessment until we get the report, but we will go to a report now from Zachary for Group 2. And I just want to remind you that Group 2, you were focusing on, my chat all disappeared, but I just was able to put it back in. Question number 5, the methods a supervisor uses are more important to the outcomes of supervision than is the quality of the supervisory relationship. Zachary, you have the floor for your group.
Right. Well, I think we were also around a 4.5.
Okay.
I actually
love
said,
it.
Yeah.
Love it.
It was I think the only one that I personally said, that I strongly disagreed with. And I thought it was actually interesting. I believe it was Heather was sort of on an island. She said she agreed, and I thought it was an interesting point she made, which was, like regardless of the relationship, if you're not using sound methods, you might not be as effective as you could be. I think, Heather, that was like your point. I think that I'm summing it up okay. Heather did go first, so it's the least clear. But I think we felt that generally, if you have a bad relationship, if you have like an antagonistic or like an untrusting relationship with the supervisee, or vice versa, it doesn't really matter, like what you could be really presenting things in a really eloquent way, but they are just they're like not ready to to hear it. They they may just sort of like write it off, even though it's you're doing a good job of presenting information.
Yeah.
So yeah, I think it's right around 4.5.
Got it. 4.5. And I really appreciate you sharing the detail from the discussion in your group in regard to what Heather brought to the table, because while you were away for that 15 minutes, I had the opportunity to reflect on our time together. And I was thinking how much I value having the opportunity to be in the learning environment with other supervisors to talk about these things and to reflect on these things, because I don't know about you, but at least in my career, this is a rare experience where you're in the company of so many other people who are interested in and focusing on clinical supervision that aren't necessarily from your organization. So what Zachary described in terms of Heather's contribution to their conversation, this is an opportunity to get exposed to other ways of considering and thinking about these things. And I really appreciate the fact that you're all sharing from your unique experience. So Zachary, thank you so much for an excellent report, and many thanks to your group.
Yeah.
So Chris, you're rounding us out for Group 3, and I'm just going to repeat the question that your group focused on, which was number 10. To the degree supervisees are I purposefully chose this question, and it's self-disclosure here. I personally chose this question for you to focus on, for a group to focus on, because I love this question. I think this is an amazing question, and it kind of reminds me of something that we either talked about on day 1 or 2. But as I was reviewing the questions and making my decision, this one really jumped out at me. So I'm very excited to hear your report, Chris. No pressure. To the degree supervisees are unaware of their needs and personal dynamics, they are likely to use their work mainly to satisfy their unmet needs. So any thought about that? And what was the takeaway for your group, Chris?
Yeah, so once we there was like once we started, we had some conversation around like what the question was like asking about. And so once we clarified that amongst all of our group members, I think most of us centered around two, like in between strongly agree and agree, leaning more toward agree. We had some conversations centered around like the trainings that some of us have had being of different experiences, some of our MSWs, some of us are KSACs, and some, just different educational tracks that we've taken.
Yeah.
And then we did discuss, just like the unmet needs and the unmet things that people are looking for once they enter the field. We talked a bit about, people's reasonings for entering the field. It's not fair to say most, but a good enough amount of times you hear people enter the helping field, social work, different professions because they've had some experience with it themselves.
Yes.
And they seek to make a difference. I think that was Margaret that made that point.
Yeah.
And most people enter the profession with that in mind. I did share a story from my experience here at my site, where a young man was he had the tendency to overtalk his peers in group, and it was to the point to where he was being very rude. And when it visibly upset his peers, it like kind of didn't cease. He kind of continued. So over time, a conversation occurred to where he was able to reveal to us that at home in his personal life with his personal relationships, he feels unheard a lot of the time.
Right.
And so amongst people who he doesn't share that, personal, as personal of a relationship with, the tendency to do that, he felt like was easier to do here.
Yeah.
In the setting there. And then we also talked about, just the need, really about what we've been sharing throughout our time together is just honesty within the supervisory sessions and just being able to, for the supervisee to kind of be aware of the unmet needs and to be willing to have the conversation, and for the supervisors to kind of be able to like point that out and just have an honest dialogue about what's really going on, so the therapeutic milieu can exist as it was intended to.
Fantastic, Chris. Thank you. Thank you so much. I thank you and your group for an excellent report on this question. And there's a process that you mentioned at the beginning that I really want to underline. You're getting some applause here. Understandably, and I also want to acknowledge, Chris, you volunteered to be the reporter. So there's something that you mentioned at the beginning that I also just want to put on the table as something for us to consider as a process. And I really appreciate that you shared this with us, Chris, is that your group deliberated at the beginning as to exactly what this statement meant. You didn't just assume that it meant one thing. You kind of put all your different perspectives on the table and you determined as a group what you felt it meant. And I just want to underline that, because that's a powerful process to go through, because if you weren't all on the same page about that, how could you really have an effective conversation about it? So thank you for reporting on that, and thank you for engaging in that process in your small group. Greatly appreciated. So I want to say thank you to everybody for completing that self-evaluation. You did it on your own, and you also then got an opportunity to focus with your colleagues on a couple of the specific questions. So what I'm going to do, folks, is I'm going to share my screen. We're going to move forward. There are a couple of other things I want to quickly cover before we go to our break, but we're going to take a 15-minute break. I'm just going to cover these few things. We'll take a 15-minute break, and then we're going to talk a little bit about an additional resource that we're going to add to our library of opportunities. And I have a little in-between reading opportunity. I'm framing it that way, a reading opportunity that I'd like to share with, and I see the smile on Chris's face as I say it that way. Yeah, thanks for the opportunity for reading. Am I reading you correctly, Chris? Okay. But there's another little opportunity for reading that I'm going to share with you in between when we see each other next. Okay, so I'm going to share my screen at this particular point. So I'll just say to you before we go further forward that there is in the slides a few more tips that can be added about supervising, quote unquote, the resistant counselor, that little scenario that we have. So I'll make sure that you are able to add this slide to the brief slide deck that I shared with you. So we spent some time yesterday looking at and exploring these models of clinical supervision, okay? These are different models of clinical supervision. Some of them resonate for us, some of them don't. We lean towards certain ones. And one of the other things that we noticed too is, especially in the treatment-based ones, there's a great parallel between providing care directly to somebody and a use of a model that's based on a care model, but that can be adapted to be used in clinical supervision. These models are all guides, and as we study them, as we understand them, we can make choices about what will integrate into what we do and what lens we will sort of apply to our model of clinical supervision. We're going to make a transition from models into modalities. And we're just going to touch briefly on these ways, these three modalities of offering clinical supervision. Now, the question that I'm going to ask you to respond to in the chat, and you can use the letters I, G, and P. If you've experienced individual clinical supervision, if you've experienced group supervision, if you've experienced peer clinical supervision, type the letter to the types of supervision that you've experienced. Now, I is for individual, so you might type IGP. You might have experienced all three, but I'm very curious as to see what modalities you've experienced. And I'm going to just quickly check the chat as you're doing that. Okay. So it looks like a lot of people have experienced two, and some even three, and some just one. So what I'd like us to consider, what I'd like us to consider is let's just walk through each of these modalities, because as a clinical supervisor, we can develop proficiency in all three of these, and they're all different ways that we can provide clinical supervision. And again, I just will repeat, anywhere along the lines here you want to make a comment, or you want to add something or add information or ask a question, feel free. So individual supervision, and as I look at my own career, I've had the great opportunity of providing a lot of individual supervision and certainly experiencing a lot of individual supervision. I've also had the opportunity of providing group supervision. I used to supervise a group of 40 clinicians, not all at the same time, but in a number of small groups. And I've also participated in peer supervision groups. In fact, I'm in a peer supervision group right now where I am a peer, and we mutually rotate leadership in who's providing supervision. But again, keeping in mind that each one of these modalities has an objective, a frequency, a structure, advantages and disadvantages. And again, from an individual supervision perspective, which is kind of what we've spent most of our time talking about during the time that we've had so far, is this idea of professional development for counselors. Again, there's a frequency to it. There's a lot of labor involved. It's individualized. And again, it can be based on a mentoring situation. And I want to underline this concept here of firsthand observation. The idea that oftentimes the way to provide effective feedback through supervision is through firsthand observation. Also, an advantage, a very particular advantage of individual supervision, again, and you'll see the disadvantage, it's labor intensive, but a particular advantage to it is that it can be tailored to that person's individual needs, where you have a rapport with that individual, you help create the professional development plan or the supervisory conversation based on what you've observed, based on what that person is doing in their work. Now, group supervision, the objective, I love these three objectives: team building, staff development, and skills practice. In a group, you can do very different things than you can do individually. You can do those things, some of those things individually, but in a group, it's quite different. It can be cost effective because you're providing supervision to more than one person, and it is something in terms of frequency. I'm in a peer supervision group that meets once a month, but some, depending on the setting, you could meet more times. Again, this is a proposed structure. Group supervisors can determine what structure in the groups that I did, that were group supervision groups that I led. There were 8 to 10 supervisees, and we did talk about the cases, and they weren't really individual cases. I was supporting people who were facilitating groups, so they were talking about their groups, which was basically their case. And you'll see, the advantage, the multiple perspectives, the time savings. The challenge, though, is it's not individualized and it may not meet all needs. Now, let's move on to the third modality. And again, I just want to underline, for the greater body of our work, or what we've focused on predominantly in regard to our conversations, is this idea of individual supervision. The professional development plan that you're developing is going to be for sort of individuals. And again, the significant disadvantage here is that group supervision may not meet the individual and unique needs of each person in the group. So peer supervision, it's a unique hybrid. And it's sort of it can be one-on-one, or it can be done, the structure can be done in a group. Again, the peers can decide what the structure is going to be. The objective, there is an accountability piece to the people that you work with, and there is the personal development, the personal professional development piece of it. The peer group or the two peers working together decide on, what the frequency of it is going to be. Again, advantage is that it can be small groups. It can also be, as I said, one-on-one. It can be peer one-on-one. It's also time limited. Oftentimes, it's not ongoing. The disadvantages can be when you have peers together, because there isn't a hierarchy of a supervisor and a supervisee necessarily, because your peers, there can be conflicts or there can be history. So I'm going to stop sharing my screen at this particular moment, and I'm just going to ask any thoughts or any reactions to these modalities, these different sort of ways of offering clinical supervision. So I just wanted to open it up and get your thoughts or get your reactions to these. Margaret writes, I've sought out ad hoc peer supervision when I had a treatment issue that I needed to work through. Of course, that would count, Margaret. Absolutely. Yeah, absolutely.
As far as peer supervision goes, I know that in one of my prior positions in a different employer, peer supervision was like one of those dreaded things that you would just dread having to do it and would kind of be taken as a joke. And it wasn't until I was paired with a clinician that was newer into the field, and that dynamic of having someone with some experience and someone with fresh experience, and doing and the way the peer supervision worked is you would watch somebody's counseling session and then go in and discuss like what you took out of it, whether it was pros, cons, things like that. And you would think it would be very uncomfortable to have someone watch you when you're in the middle of doing it. And it turned out to be like a really beneficial experience for the both of us, in the sense of it was a case that she wasn't familiar with. It was one of her type of clients that she struggled with. I believe it was something, I can't remember exactly what it was, but a borderline client. So, and it was something that she identified as something she struggled with. And then just also me witnessing her with a power struggle with a client, but also getting her take on it, being fresh out of school, and her new fresh eyes on it. So it was really beneficial to have those not power dynamics, but dynamics of experience. So I feel like it's definitely beneficial for supervisees to have that experience of peer supervision, to where you don't have that supervisor power dynamic, but you have someone that's equal to you and getting different perspectives, for sure.
Yeah. And Letitia, thanks for telling us kind of both sides of that. If you don't mind, could I ask you a quick follow-up question?
Yeah.
Could you say a little bit prior to this experience that you describe, and it sounds very beneficial, and as you were describing it, I could really see how that could work, how, observing somebody's work, and if you're less experienced with them and then having a dialogue with them about it, I could see how that could be a benefit to both people completely. But prior to that, you said that your reaction or your relationship to peer supervision, what it was dreaded and it was a joke. So I'm wondering if you could say a little bit about why that was actually the case.
To be honest with you, I think it was just the culture of where I worked, where it was just one of those things, like it was set up as a task, another job, what you had to do of, you have to set up a time with your peer to do this extra thing. And I think it all had to do with just the environment, the work environment, to where same thing as in the beginning, where they talked about how the TAP 21 was just thrown on their desk. Same thing. It was just thrown at us as another task. So it was dreaded.
I love the fact that you said that, because as you were saying it, I thought, oh my God, that's a TAP 21 dropped on my desk moment. And I could see why it would be received that way. But I'm also glad to know, and thank you for sharing your experience, I'm really glad to know you experienced the other side of that too, that in a peer setting, it could be very beneficial. Thank you.
Definitely. And definitely setting that preface, setting it up, in whether it's in individual supervision, of explaining what the purpose of it and what the goal is to get from it and why you're assigned to the specific person, or whatever the case may be, to show like the supervisor also put in some work, like to show your supervisee that I put in some work in this task as well, of I put some thought into this assignment, and then I'm hoping you can take out of it what I know you can get out of it, kind of thing. Could have made all the difference in the world.
So thank you so much. Any other thoughts or any reactions on these modalities? Individual, group, peer. Is there anything that anybody else would like to say in regard to that before we sort of go forward? Okay, excellent. So what I'm going to do is let me advance the slides for a moment. So what I'm going to suggest that we do at this particular point is I'm going to ask everybody to turn to page 37 in your participant workbooks. And again, the first person to get there if you would be so kind as to unmute and shout out what you
performance assessment rubrics and screen competency. Screening.
Okay, 37 should be the name of a character, Evan. Is Evan there on 37? Yeah, is everybody seeing Evan?
Yes, yes.
Fantastic. So what I'm going to ask is, would somebody be so kind as to unmute and read the Evan scenario out loud to the learning community? Would somebody be willing to do that? Would you be willing to unmute and read the scenario out loud to the learning community? Thank you so much. Go right ahead, Mizelle. Thank you.
Evan is a master's level social worker who works mostly with criminal justice clients. He is part of a multidisciplinary team working to engage and retain clients in cognitive behavioral treatment for at least 90 days. Evan's philosophy of treatment is that clients should be expected to demonstrate a willingness to participate and the readiness to change behavior. If the client is resistant, Evan is in favor of discharging the client and express impatience at the team's hesitancy to do so. Which modality of supervision might best fit for this staff member?
Great. So let's pause right there. Mizelle, thank you so much for reading that. And I don't know if anybody saw this, but Juan, as Mizelle was reading this, you seem to have a reaction to it. And I just want to make a suggestion. Consider not playing poker.
I did too, but my camera was off. I cheated. I was like, oh, not this one.
Okay, so Margaret, let's start with Juan's reaction, and then we'll go to your reaction, and then we're going to come back to the question that Mizelle asked. So Juan, what was your reaction? Because am I correct? I could be wrong. Did I see you have a reaction to the scenario? So Juan, did you have a reaction? And if you did, what was it?
I did. I don't think that type of approach, it's not going to work in that population. You know, I worked a lot in substance abuse, and, you know, the whole non-compliant, compliant stuff doesn't really work for that population. I worked for the VA in a homeless department where we were getting them housed using Section 8 program, and they used the housing model first modality. And initially, coming from substance abuse, I was like, what are we doing? We're going to get them housed first, and then regardless of whether they engage in treatment or that, I was hesitant to buy into it. But then after doing it and working it for some time, I realized, like, you know, sometimes you got to, you know, just meet those core essentials needs of the clients before they even address anything.
Yep.
So, you know, we don't know where those clients are at in regards to their recovery or their process. And by, you know, and their hesitation to not engage in care, to then have a punitive action.
Right.
It's
right.
You know.
Right. Yep. Got it. And again, I really appreciate the fact that you were willing to kind of have your reaction on camera, whether you knew you were having it or not. And the reason is because, and Juan and Margaret had a reaction too, but we couldn't see her face because she had her camera off. But we're going to hear her reaction in a minute. The thing I really want to underline, and I thank you both for this, is as these situations come up in clinical supervision settings, we will have reactions to them.
Absolutely.
And we need to know that so that we can still provide appropriate and beneficial clinical supervision to this particular person. So Margaret, I'm going to give you the floor to share your reaction as well. And then we're going to come back to Mizelle's question.
Mine is just based on for the past, since substance use treatment has moved away from a punitive approach to behavioral change. I have spent, at a minimum, I have to intervene at least 5 or 6 times daily with, I have program directors under me that I have to continuously teach that the first thing we learn about psychology is Maslow's hierarchy of needs, right? So if you can't feed yourself, if you have no roof over your head, if you're physically unwell, you are not going to be able to focus on treatment, and you never will, because we just keep going in this endless cycle.
Right.
And then also, let's leave the punitive approach to jail. We are providing treatment, which is not punitive. If you're not doing a good job of cleaning a wound that you got stitched up, does the doctor kick you out of his practice? Or does the doctor work with you to find a better way of maintaining your wound and following through with the treatment plan? But this is across and in so many ways. It's across all levels of seniority, from upper level management to team leads to direct care providers. It's just, I get, the reason for my face is that I'm like, I can't escape this. This is like,
well,
what is so hard about this?
Margaret, you're confirming for me that I chose the absolute right scenario for our learning community.
Yeah, it's just people really have a tough time changing their orientation, their treatment orientation. And once they've started in, say, the TC model or some of the older models of care, kind of breaking them out of that can be quite difficult. So it's a constant thing. That's
fantastic. Fantastic. Thank you. Trisha, go ahead. You wanted to comment, and then I want to come right back to Maisel's question, because there's a question that I need to ask everybody before we take our break. But go ahead.
I was just going to say briefly, like, coming from an organization of law enforcement right now, I've been trying to teach my colleagues the hierarchy of needs. Like, we can't just continue to keep incarcerating people when we know that they have problems, that we have to deal with those problems first before we could, especially with substance use and not having housing. You have to understand that there's a way of doing things, and just incarceration is just not the idea,
Yeah.
And to do this, it's just, it doesn't make any sense to me. That's why I kind of cringed, and I was like, when I heard when you read that. So it was, so.
Well, again, you're really confirming, as has Juan and Margaret, that I chose the right scenario for our group. So this is the question. Maisel asked and read at the end of the little scenario, what treatment, what supervisory modality is going to be best for Evan? And what I'd like all of us to think about, based on what we talked about, the advantages and the disadvantages, the benefits and the intents of individual, group, and peer supervision modalities. I'm going to ask everybody to consider for a minute. Which modality or modalities do you think Evan would benefit from? And I'm going to ask you to type in the chat. If you only think one, type the letter. We have individual, which is I, group, which is G, and P, which is peer. If you think it's only one, feel free to just type one letter. If you think it's more than one, type whatever the letters are that you think he'd benefit from. Now, at random, I'm going to pick from what you put in the chat, and I'm going to ask two people to say why they think Evan would benefit from these particular models that they chose. Okay? So I see that people are voting. So let me take a look at who's here. And Holly, if it's okay, if I could ask you to unmute, if you'd be willing. I see that you've voted that Evan would benefit from individual. There are a number of people who agree with you. And I'm just wondering if you could say a little bit about what your rationale for why individual would be a good modality for Evan. And I'm hoping that you can unmute, but you'll let me know.
Can you hear me?
Yeah, go ahead, Dr.
There
Holly.
we go.
Yeah, go ahead.
Yeah. I was just really just going off the back of the fact that he works mostly with criminal justice clients. And so he can be coming from a framework of that particular type of population. Even though he's a master's level social worker, he may not have a working knowledge in in working with other populations. So while that experience is good, I would like to meet with him one-on-one to kind of see what can be used and then what types of skills that he could probably enhance to be able to, I guess, further work with the clients around their readiness for change and behavior.
Okay. And there's a word that I want to throw out, and tell me if it kind of crystallizes your rationale, is that you'd be able to really tailor and individualize what you could help him focus on. Am I reading that correctly?
Yes, that's correct. I would rather do that first, and then based on what I get, then I could possibly put him in a group or with some peers. But to throw him in those settings first, I don't know if that would be helpful in my opinion.
Fantastic. I get it. Thank you. And let's just hear from one more person. Julie, I see that you chose individual as well as peer. And I'm wondering what your thoughts were, if they're any different than Dr. Holly's on individual, and what you might have to say about why you think peer might be a helpful modality for him as well.
I did agree with Dr. Holly as far as the individual building some skills could be helpful for him.
Yeah.
Actually, the more I'm thinking about it, I think all three would probably help him.
Okay.
I do think that I put peer down because I think I sense they said, what did they say? Has some sort of feeling about the team, right? Impatience, right?
Yes. Interesting.
So I do think that it's in the client's best interest to work as a team. So I thought maybe peer supervision could help change his, maybe they're coming at it from a way of, I don't know, peer. I just felt like peers coming at it from a way, a different kind of a way would help him. I don't know how to word that. I don't know.
Fantastic. And I'm intrigued by your suggestion, especially because you're noting that it could be an opportunity for him to kind of manage or focus on his impatience with the team.
Yep.
That if he's interacting with peers, it may bring that to a head and maybe then resolve it.
Yes. Yep. Exactly. Much better said.
No. I got that from what you said, Julie. So I got it. I'm really intrigued by that, and Juan agrees with you. Excellent. So, folks, I can't thank you enough for your focus so far. And what I'm going to ask that we do now is let's take a 15-minute break, and we will come back after 15 minutes. And we will make a transition into the next piece that we're going to focus on, which is adding a new resource to our resource library. So have an excellent 15-minute break, and we'll see you in 15 minutes. Excellent. Welcome back, everybody. I hope that you had a good break. As we start to bring our learning community conversation to a close today, there are two things that I want us to be able to cover. So the first one is I'm going to ask everybody to turn to page 41 in your participant workbook. And again, the first person to unmute and tell me what's on the page of 41 would be greatly appreciated.
Methods for building support and enthusiasm.
Thank you. Excellent. Yes. And you'll notice here, folks, as you look at this, that there is a reference to tip 52 in regard to this particular building methods for building support and enthusiasm. Now, you'll see here, if you look at this, that there are 5 steps that they're acknowledging here. And I want to be clear about what these steps are suggesting that we build enthusiasm about. One of the most ideal ways to provide specific feedback in regard to counselor performance is through direct observation. And that can be direct observation being in the room, two-way mirror, recordings, audio, and video. So what this particular aspect of building enthusiasm is really focusing on is building enthusiasm in the face of possible reluctance, fear, or resistance to direct observation, which is often a part of clinical supervision. And I'm actually going to ask you a question in regard to that, which is use the chat if you as a supervisee have been directly observed. Have you been in a situation where direct observation, where you were directly observed? And you can just type a Y in the chat for yes, or no in the chat for no, that's not the case. You were never directly observed. But if you've ever had that experience, weigh in the chat. Yeah, so Amber says no in capitals. Lourdes says no. Margaret says yes, but only in my MSW placement. Yeah, okay, and so the context. But it seems that most people have had the experience. Well, what I can tell you folks is that there are times when supervisees, the way to get a best handle on what they're actually doing is through direct observation. So what this is suggesting in the participant workbook, and if you want to turn back to that again, is that you can touch on these 5 points as a way to build enthusiasm in regard to direct supervision. And if we were looking at point number 1, which is present the rationale in terms of what is the rationale for clinical supervision and in particularly direct observation. What is the rationale? So I'm going to pose that question and ask whoever wants to answer that. If I was your supervisee and I said to you, well, hey, supervisor, what's the rationale for clinical supervision and direct observation? As the clinical supervisor, how would you answer that? Does anybody want to answer that as the clinical supervisor speaking to me, the supervisee? Eunice is asking, did you save direct observations? Could be asking a client questions. I'm not sure if I understand what you mean by that, Eunice. Can you elaborate?
I was asking, could direct supervision be a way of when like the supervisor would speak to a client referencing the clinician to see if things are going okay? Would that be a direct way of
well, that would not be direct.
That
wouldn't be direct observation. That would be consulting a secondary source, because direct observation means you observed their interaction with the person. Yeah, but again, sometimes we do client satisfaction surveys. We may not ask about a specific clinician, but we may ask about our clinical team in terms of asking folks to rate. So you're not necessarily far off the mark there, Eunice, but it would be hard to sort of provide any kind of specific feedback because we'd be getting a secondary report.
Secondary, okay.
Alexine, what were you going to say?
As a rationale, I would explain to the supervisee that it is because of the need to have accountability. And because I am responsible for what transpires in the clinical room, that I need to see what is going on and not just only rely on the self-report of the clinician. So that would be a rationale. And it not only does it protect the clinician or the supervisee, it protects the client, the agency, and the supervisor.
Fantastic. And, you know, and I love what Juliana just wrote in the chat too, because it speaks exactly to what you're saying. We don't know what we don't know. And if you don't know what's going on, you can't really give feedback about that. Yeah, and wants to see you. It's about seeing you in action. We do, that's part of what we need to do. Yes, yeah, and Juliana is also acknowledging that clinicians don't always know what may be problematic. Yes, and that's why having outside sort of support. So Alexine, would it be okay if I borrowed your rationale for a moment and you were the supervisee and I'm the supervisor? Would that be okay?
Fine.
So, you know, Alexine, I'm really glad we're talking about this. And if it's okay with you, I'd like to just say a little bit about the rationale for direct observation, and then I'd like to get your take on that. Would that be all right?
Yes.
So I appreciate you asking why it's necessary, and I'm glad we're going to be able to have the conversation about it. The agency, just as a practice, does mandate that all clinicians are directly observed and that they are able to receive informed feedback from their supervisors. And that's the policy. And I think that there are some other really good reasons too, which are that it kind of helps you be protected in your work and your professional development, because when you and I talk, I'm going to be able to really talk about what you're actually doing. It helps me remain accountable as your supervisor, because I'm going to be able to help support and guide the direction you want to go in and build the strengths that you have and help you to focus on any growth opportunities you identify. And ultimately, it can play out as benefiting, you know, individual clients and patients, because if the whole clinical supervision team is directly observed, we're all kind of maintaining a high standard of practice. I'm wondering what your thoughts are about that rationale, and if you see any benefits of direct observation as well.
Well, I think your rationale makes a lot of sense on the different levels that you have shared. I still don't like the idea. However, I'm willing to better accept the need for it, and hopefully I'll get used to it one day and not it bother me so much. But it does, you know, it's a policy requirement. It protects me. It helps me to grow and develop. So that makes sense. It also benefits my clients, because there may be a different or more effective way that I can treat my patient that I had not thought about because of the feedback that I get.
Yeah, and you know, thank you for being so open to try something that you're not necessarily comfortable with. And you know, I want you to know, Alexine, you're not alone in that. And I'll just share from my own personal experience of being observed. I didn't really like it very much at first either, and I kind of grew into it because I actually did experience the benefits of it. And you know, the other thing that I can offer, and maybe we can talk about this in supervision, and you can tell me what your thoughts are about it, but I can also offer to have you directly observe a session that I might do, and then, you know, that may be a way for us to start, and then, you know, we can talk about that as well. What are your thoughts about that?
I think that would be very helpful. I would appreciate it. And I do appreciate the disclosure as well.
Oh, well, I'm happy to share that with you. I think it's a pretty normal reaction, and like you said, it is the policy, but the policy is there for a reason. You know, your protection, the quality of the work, the beneficial outcomes of the client. So I'm really glad that we're able to kind of be on the same page about this. All right, so a couple of things, folks. I think I hit all 5 points. If you look at the, I think in that little sort of impromptu, unexpected Alexine Academy Award winning performance, excellent supervisee. I'd be happy to supervise and be a collaborator with Alexine at any time. But I think I hit all 5 of the points. What do you think about that? Do you think I hit those 5 points? Or do you think I missed anything? Or is there something you might have said differently? And then we're going to go to Beretta and we're going to go to Lourdes. So what about the 5 points? Did I cover the 5 points in that brief conversation? You can say yes, no, whatever you think. Yeah, Charles has given me a thumbs up. Okay, that's 1. Thank you, Charles. Okay, Samantha reluctantly types a Y in the chat, and Brittany follows her. Okay, so again, folks, my whole point is the point that I'd like you to really take away is that the tools that we have are guides. They make suggestions about how and what we may want to cover, but practicing, like Alexine and I just did, is a real way to kind of really start to try it on and take it on. So just keeping that in mind. We're going to go to Beretta and then to Lourdes, and then I have one other thing I'd like to share with you, and then we'll be done for the day. Go ahead, Beretta.
That's a pass. But I just want to say the role play was super. I really did enjoy it, and I've learned a lot from it. I've learned the way that you both collaborate and the way that Lexi came in, and it was so timely done. Well done. I really appreciate it. But my question is pass.
Okay. Do you want to go back to it?
No. I'll give it a pass.
Okay. Lourdes, the floor is yours.
Oh, okay. Sure. Do you want a comment from the conversation with Alexine? Is that what you asked?
Whatever you'd like to respond to.
I thought that's well, yes, I do appreciate you doing it, but the one thing that I noticed from you is the one I don't know if it's in the 5 points around here. I'm reading it. But you offered the supervisee to observe you.
I did.
Yeah, no, I like that. But how about if the supervisee is reluctant and resistant and seems to be not sure? What about you? Because it happened to me. My supervisor let me into the group and said, just sit down there as an observer. It's like that. So I feel like you are hitting the right point there, supervisor, to say, okay, if you are not comfortable with this, why don't you observe me while I'm doing this? Is that what you said? So I mean, that's very important, because anything that's new, remember, you are there, I am not there, probably a lot of us not there. So anything like a group, anything like that, you want to see how it will be done right. So
yes,
to see you there and then observe me observing here, sitting down at the back, it's a big deal. And then next, it's like modeling. I don't know what is that.
Yes. I think you're absolutely right. And I want to point out something, and I want to be very clear, because I made this, I think, very clear in the role play. I wasn't suggesting that Alexine observe me instead of being directly observed. What I said is I suggested that she could observe me before she's observed. Because again, right, because the thing we want to be clear about, folks, is that everyone undergoes direct observation. And the whole purpose of these 5 points is to build enthusiasm and to help people to ease their way into what is a requirement of their employment. That if you're in this role, you're going to be observed. Julie writes, loved the use of the word and in place of but makes a big difference. I agree, Julie. And I'll tell you, and it may not be a surprise to anybody in our learning community, I am also a practitioner of motivational interviewing, and I also train motivational interviewing. And motivational interviewing is very fond of the and instead of the but. So it does kind of, it is part of the foundation of my unique model of clinical supervision as well. All right, I'm going to share my screen with you folks as we start to bring our conversation to a close for today. And I'm very much looking forward to our fourth session, although I have to admit, yes, go ahead.
I just wanted to say one thing to it. I think
go ahead, Charles, please.
Introducing the opportunity for her to observe you as well, it also normalizes the process. Yes. And yes. Hey, this is just something that we do. It's okay. I do it. You do it. Everybody does it.
Yep, I agree with you 100%, Charles. And I want to link that to what Lourdes said, because it also is an opportunity for modeling. And who knows, folks, and Lourdes, you know, I appreciate your vote of confidence, but what if Alexine observes me and like I screw it up? I don't do it as well. And like there's benefit in that too, because then Alexine and I can talk about like, well, gee, how could I have done that differently? Which is also normalizing that people don't always, you know, do it right all the time. So keeping that in mind. Alexine, did you want to add something else? You would need, go ahead. Yeah.
The way that you presented this information to me might be the way that I might have to present it to a client who doesn't want to be on screen and present.
Parallel process again.
Right. So this is helpful in how we would engage a client in it's helping them to understand why they might have to be on camera, be directly observed.
Yeah, absolutely. So folks, I want to walk you through, and this is kind of our I'm going to touch on a couple of details, but I want to walk us through something technical that will benefit what you do in terms of the professional development plan. But I want to be very clear with you. I'm walking you through something technical, okay? Because we're going to introduce a new resource into our conversation. So I'm going to share my screen again. Now, again, a couple of details before we walk through this technical thing. Part of the method, the modality that we use when we provide clinical supervision depends on a variety of things. It certainly depends on resources, personal preference, supervisee needs, and also agency policy. It's important to keep that in mind. We also talked about that with direct observation, there's live, there's one-way mirror, there's audio and video recording. When we're working individually with somebody, we can engage role plays. We can do interpersonal process recordings. Hopefully nobody's having like a PTSD flashback in my saying that. I had to do them when I was in social work school. If we use a group method, we can focus on case consultation or team or peer feedback and skills practice. And these are those 5 points that we touched on as a way to build support or enthusiasm for clinical supervision and specifically direct observation. And again, I just wanted you to have these slides. You have the complete deck. So, Dr. Holly mentioned early on, like, wow, wouldn't it be great if there was some assessment tool or a rubric that we could use? Well, there is one. And it's called the Performance Assessment Rubrics. And we use it in combination with TAP 21. And remember, TAP 21 is the group of competencies that are for the clinician. We as the supervisor look at these competencies. So TAP 21 is for the provider, the counselor. So TAP 21, it's looking at these addiction counseling competencies. They're all framed under practice dimensions. You've started to look into this particular resource. when you do your professional development plan, you'll be using this resource in addition to the new resource that we're adding. You'll notice in these competencies in tab 21 that they're broken down by the competency and then the knowledge, the skills, and the attitudes that are associated or compose or add up to this particular competency. So that's how these are set up. When we develop the professional development plan, we use tab 21, which is again the addiction counseling competencies for the counselor or the provider that we as the supervisor are using. We use that in combination with the performance assessment rubrics. Okay, the rubrics are the way we can assess where that person is with their competency. Okay, so it's two resources that work together. Tab 21 identifies the competency and gives you what makes up that competency. And there are many of them, as you know. And then the performance assessment rubrics helps us look at each one of those competencies and evaluate. And if the performance assessment rubrics are new to you, type an N in the chat. And if you're familiar with them, type an F in the chat. So if they're new, type an N. If they're familiar, type an F. Just going to check that quickly. Okay, so a couple of people are familiar. Number of people, it's new. Not new, but also hasn't seen them in a while. Understand, Brittany. Makes sense. Brittany Davis. Excellent. Good. Okay. But again, the thing I want you to walk away with is these two resources work hand in hand. Now let's walk through that. You'll see here that this is one of the pages. It has competency number 1, and you could find that in tab 21. And it has competency number 2. You'll see that they're broken down into 4 different degrees or on a continuum of awareness, understanding, applied knowledge, and mastery. You'll see awareness is rated as a 1, understanding as a 2, applied knowledge a 3, and mastery as a 4. Okay? So each competency is rated on this 4-point scale of awareness to mastery. Awareness being the lowest rating, number 1, and mastery being the highest rating, number 4.
What page is that on, Paul, in our workbook?
That's not in the workbook. I'm not sure what page it's on in the workbook. Hold on a second. Let me see what it says.
Is that in our handout workbook?
You don't have this handout yet.
Oh, okay.
We're going to send you the rubrics. Okay. I didn't want to give you all of this stuff at once before you kind of had a sense of what it is.
Yep, no problem. Thanks.
Okay. So you'll see again, folks, that the rating is 1, 2, 3, and 4. Again, awareness, a 4-point Likert scale to mastery. So what I want you to be clear about is that this continuum, when you're looking at a particular competency from tab 21, you can use this continuum to evaluate where a particular supervisee is in regard to that competency. Okay, so just keeping that in mind. Now, what I'm going to ask everybody to do is in tab 21, find competence 24 and tell me what page it's on. So in tab 21, find competence 24 and tell me what page it's on and type that page into the chat. Bingo, Charles has got it, page 39. Brittany's got it, page 39. Once you found it, type that page into the chat. Excellent, excellent. Excellent. And find it in the tab and type it into the chat. Fantastic. 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 Good. So congratulate yourself. You just found where competency 24 is in tab 21. Your mission, if you choose to accept it, is, hold on just a second, I'm going to stop sharing my screen. Your mission, if you choose to accept it, is we are going to send you the rubric. And we want you to find what page competency 24 is on in the rubric. And we want you to read that page for that particular competency in the rubric. Okay? So you found it in the tab 21, and now you're going to find it in the rubric. Okay? These two resources work together. They are going to help you with the professional development plan. I am going to put that together when we meet next. Okay? So, in the last 10 minutes that we have together, I'm going to ask you to do the following. And please make a note of this, because we're adding one more resource, and Beretta already referred to this resource, and George referred to this resource, I believe. And that resource, or maybe it was Charles who referred to it, because I'm not sure if we have a George. Charles, did you refer to tab 52 early on? Did you ask me a question about tab 52? I'm remembering that correctly. All right, so it was Charles that referred to this. In tab 52, I'm going to type a reading opportunity into the chat. And this is what I'd like you to focus on, because we're going to send you tab 52. So in tab, I'm typing this into the chat. Tab 52. I want you to read pages. Yeah, tab, T-A-P. This is not a tip, it's a tab. We have tip 21A, we have tip 21, and this is tab. Am I mixing it up? No. Okay. Reverse that. It's 52. So this is what I want you to read. I want you to read pages. Yes, that's it. You've printed it out. Fantastic. All right. I want you to read pages 11 through 13 and pages 44 through 51.
Sorry, Paul, what is that? Is that, can you repeat the tip what or top?
This is tip 52.
52, okay. Pages 11 to 13 and 44 to 51. Is that right?
You got it. You got it. You're very welcome.
Well, could we go back to the first thing? What competency in the first assignment it is we must look for?
24, page 39.
24.
Yeah. In the tab, in tab 21, it's competency 24. This is the math portion of our training. we identified that it's on page 39 in the tab.
Mhm.
And your mission, if you choose to accept it, is you are going to find what page competency 24 is on in the rubric, which is a separate document.
So you want to send a rubric source?
Yep, we're going to send you the rubric and we're going to send you tip 52.
Oh.
And some of you have it already, which is great. So you can begin the reading opportunity whenever you like. Charles, go ahead. Please take the floor.
Just a quick question, and you may answer it today or for the next session. But I believe the best practice for these rubrics would be the supervisee rate themselves on these competencies, and then the supervisor also rate, because they may have a mismatch between the two, right?
Well, that would be best case scenario, because if nothing else, that would allow you and the supervisee to have a great dialogue about it. So Charles, your point is an excellent one. And again, keep in mind the kind of slowed down process that we're going through to become familiar with these instruments, because what we want to avoid with these resources, because what we want to avoid is plunk, here's tip 52, find the competency, and let's talk about it. We definitely want to avoid that. Okay? So just being very clear, if you're going to do that, you want to take the supervisee through a process to become familiar with the tool. But Charles, I think that would be very high level and very effective clinical supervision. Yeah. Lourdes, the floor is yours.
Quickly, this is not in relation to this, but I remember you told us from the beginning that those people who are not just supervising and doesn't have a supervisee, you will give an offer for a vignette or a
yes. Yep.
So would that be possible, because we only have 1 week to do this, and I kind of wanted
yes,
to
it
possible?
Absolutely. And you won't get the vignette until we've completed part 4.
Oh.
Because everybody is hopefully you're not working on your professional development plans now, that you won't start them until you complete part 4.
Okay.
We all identified in tab 21 that competency 24 is on page 39.
Mm-hmm.
Your mission, if you choose to accept it, when you get the rubric, is to find out what page in the rubric competency 24 is on. All you have to do is find the page. That's all I'm asking you to do. And that is going to establish the link between the two documents, because they work together. They're used in tandem. Okay?
So we're just listing the page number?
All you got to do is find the page number. That's it. What I'm saying everybody probably could start filling out the form immediately. You could have started filling it out on day 1. But what I'm asking you to do, and I'm asking you to consider doing, is engaging in this process within our group learning community, and then we'll all start after session 4.
Good. Sound good.
Fantastic.
Thank you.
You're welcome. You're welcome. Thank you. Yes, locate competency 24 in the rubric. What page in the rubric? Okay. Folks, I'm going to ask you, just as a way of concluding in our last 2 minutes, one word that describes your experience of being in our learning community today. One word. I'm going to tell you my word. I'm not going to type it in the chat, but feel free to type your word in the chat. But if you'll indulge me, I'm going to verbalize my word. And my word is this. I found our conversation thrilling today. And I thank you so much for what you brought to it. So please type your word in the chat. And once you've done that and you've looked at what people have typed in the chat, we we'll see each other in session 4. Excellent. Yeah, or different, yeah. Okay, excellent. All right, so just a reminder, folks, your mission, if you choose to accept it, find the page in the rubric for the competency we identified, and please do the reading in tip 52, the reading that was assigned in tip 52.